Dr. Nandi, for the generous introduction. It's really my pleasure to moderate today's session. So as we know, COVID has truly tested our collective resolve and particularly the capacity and commitment of institutions to respond to the crisis. And it goes without saying as well that governments have a pivotal role to play in coordinating a comprehensive response. We've definitely seen varied responses by governments, some positive, some disheartening. And in addition to the more comprehensive general response of governments, it's critical that they also identify and meet the needs of diverse groups of citizens, including those with disabilities. So today, the panelists will provide insights into the efforts of governments around the world to address the needs of persons with disabilities. And it's all kind of framed within the normative framework of the United Nations Convention on the Rights of Persons with Disabilities. So it really is a pleasure to be able to introduce this exceptional panel and look forward to their talks. And we'll begin today with Dr. Ciara Brennan. And Dr. Brennan was a research and advocacy consultant for the COVID-19 Disability Rights Monitor. For more than a decade, she's worked in human rights research and disability rights. She's been a consultant in Ireland, Iceland, Sweden, and at the European level. She holds a PhD in disability studies from the University of Iceland, and she was awarded a Marie Curie scholarship to study the implementation of the UN Convention on the Rights of Persons with Disabilities across the European Union, and is joining us from Ireland today. So we're very fortunate to have her presenting. So I'll pass it over to you, Ciara.
Great, thank you so much for that introduction, Raphael. And good afternoon, everyone in Canada. So today I am going to be presenting on behalf of the COVID-19 Disability Rights Monitor, which was a consortium made up of 7 human rights organisations, including Validity Foundation, the European Network on Independent Living, Disability Rights International, the Disability Rights Fund, and the University of Pretoria Centre for Human Rights and Disability. So to begin this presentation today, I would just like to invite people to visit the COVID DRM website, www.coviddrm.org. And there you will find a link to the full presentation, which I will touch on very briefly today. So in the report, you can find a lot of quotes from people with disabilities from all around the world. And you will also find a long list of recommendations urging governments to build back better. And that's based on the findings of this report. The quote that I have here on this slide today is from a woman with a disability in Canada. She said that people with disabilities will die in hospital or at home because either they cannot access services or because the hospital staff are stretched thin and don't have time to meet their care needs, or because the system doesn't see value in their lives and prioritize the care of others. And unfortunately, this woman's assessment of the situation really reflected the sentiment of people with disabilities around the world. We found that governments failed to take measures to protect the most fundamental rights of persons with disabilities around the world, regardless of the country's level of income. So the survey began it launched back in April 2020, so at the beginning of the pandemic. And the aim of the survey was to launch emergency monitoring of government measures to protect the rights of persons with disabilities. The survey was open from April to August 2020, and it aimed to really try and amplify the voices of persons with disabilities around the world, because at the time these voices were not being heard. In order to reach as many people as possible, the survey was available in 25 languages. The survey received an overwhelming response from around the world. It received 2,152 responses from people in 134 countries. The vast majority of the respondents were people with disabilities and their representative organisation. In addition to this, the survey received over 300 written testimonies from people all over the world. Hence, the analysis of the data was both, it was mixed method. It was both qualitative and quantitative analysis. The survey, the vast majority of the respondents were from North America and Western Europe. And the countries with the most respondents were Germany, Italy, France, Austria, the USA, South Africa, Mexico, Canada, and Nigeria. One of the aims of the survey was to find out about the situation of persons with disabilities who are hardest to reach. So those who are living in institutions, including group homes. 1/3 of the survey respondents believed that their governments had taken no measures to protect the lives, health, and safety of persons in institutions. And this included a lack of access to PPE or denying medical treatment for persons in institutions who contracted COVID, whilst the workers in the institutions were given medical attention in hospitals. As I said, just 1/3 of people said that the governments took no measures. However, of those who said that their governments did take measures, a further qualitative analysis of this showed that many of the measures that were taken by governments violated fundamental human rights of people living in institution. And this included closing institutions, banning visitors, and denying medical treatment for COVID. A respondent from Bulgaria said that the measures that were taken to prevent infection, but it is also a measure that could lead to lack of care, lack of transparency, and concealment of dangerous abuses. In other words, human rights abuses could take place behind closed doors. The survey also found a fatal breakdown of community supports. So supports that enable people to live independently in the community. Only 6.5% of the survey respondents said that they received extra financial assistance from their governments, and this was despite reports of significant increases in the cost of living. 38% of the people that responded said that they did not have access to personal assistance services that they had before, and 33% said that they did not have access to formal care. One of the respondents from Canada explained that the cost of living has gone up exponentially, but our benefits have not. The survey also aimed to reach underrepresented groups of persons with disabilities, including children, homeless persons, and women and girls with disabilities. 43% of those that were surveyed said that their government had taken no measures to protect the rights of children in their country. A further 51% said that no measures were taken to protect the rights of homeless persons. 59% said that no measures were taken to protect the rights of persons with disabilities in rural areas that lacked transport or access to food. And one respondent from Nigeria said that children with disabilities and their parents are still in the street with no face masks, and their lives are in danger. The final section of our report focuses on access to healthcare. And one of the overwhelming responses of the survey was that people with disability lacked access to basic healthcare. 52% of the respondents said that people were denied or deprived of healthcare during the pandemic. A further 30% of the respondents said that people with disabilities did not have access to all of their medication during the pandemic. And the final quote here is a quote from a DPO in the UK that drew our attention to do not resuscitate notices that were placed on people with no consultation, especially older persons with disabilities. Now, keeping in mind that this data was collected at the very beginning of the pandemic, and it was an emergency piece of research. So the things that came out of their DRM survey really drew attention to some of the human rights violations that were occurring around the world at this time, and unfortunately continue to occur. So that's my presentation for today. As I already mentioned, I would like to invite you to visit the DRM website, where you'll find a lot more information on the study and also the methodology. Or if you can't get access to that, you're also welcome to email me at this address. So thank you for listening, and it's quite a short time to share such a wide range of findings, but I hope that you'll find the report interesting as well. So thank you very much.
Thank you, Ciara. That was wonderful. One housekeeping note that I forgot to mention is if you could hold your questions to the end, we're going to have time for discussion. So when we get to that point, you can use the hand raising icon or write your question in the chat, and we'll hopefully, and I'm sure, have an enriching discussion. So now we'll move on to Sébastien Jodoin, who is an assistant professor in the Faculty of Law here at McGill University, where he holds a Canada Research Chair in Human Rights, Health and the Environment. He's a member of the McGill Center for Human Rights and Legal Pluralism and an associate member of the Institute of Health and Social Policy. His research focuses on three broad themes: the relationship between human rights and the climate crisis, transnational and comparative climate law and policy, and the role of disability rights in addressing complex environmental and health issues and challenges. So it's really a pleasure to pass it over to you, Dr. Jodoin.
Thank you so much, Raphael. I'm going to briefly give an overview of the field of the rights of persons with disabilities, looking at the context of the pandemic and building on Ciara's compelling and important evidence and testimony regarding the impacts of the pandemic and control measures on people with disabilities. Keiko, I forget. Oh, okay, you are going to switch. Okay, right. Okay, so first, I just want to start by briefly introducing the concept of the human rights model of disability. So this model of disability, what characterizes it is first the recognition that disability is a result of an interaction between long-term sensory, physical, or mental impairments in interaction with barriers in society. So recognizing that certain impairments may create certain needs that need to be fulfilled, and also, however, that most of the time disability, the challenges of disability are really linked to negative attitudes in society, inaccessible infrastructures, barriers that exist in society. And so the human rights model, what it does is it looks to recognize people with disabilities as rights holders that are entitled to measures to ensure that they live a life of dignity in equality with others, and can achieve a form of transformative or substantive equality in society. The other element that's really important to think about in the human rights model of disability is intersectionality. So in the convention itself, there's a recognition specifically that children and women with disabilities face multiple forms of oppression that, again, requires and deserves special attention and initiatives. The convention, which was adopted in 2006 and came into force in 2008, has been ratified by 102 parties, so 181 states and the European Union. And what it does is it clarifies the full range of disability rights. So just to be clear, if you had a disability, you already benefited from your rights protections under existing human rights instruments. What this convention does is it clarifies, specifies the rights of people with disabilities across the full range of rights. So civil, political rights, such as right to life or right to freedom from torture, but also economic, social, and cultural rights, such as the right to life or the right to education. And then there's also in the convention 3 sort of specific rights to people with disabilities relating to accessibility and other related topics. So I just want to briefly mention 3 articles that are key to thinking about the rights of persons with disabilities in the context of the pandemic. In reality, all of the articles, pretty much all of the articles are relevant to understanding the pandemic, its impacts on people with disabilities, and the types of measures that governments should adopt. But I'll just focus on these 3. So Article 4 is an article that creates a general set of obligations on states to consider the rights of people with disabilities when they develop policies that concern them, and also to engage and consult people with disabilities in the development of policies. So this, of course, would apply to any area of public policy, and is something that was quite critical and in many ways, in many countries, lacking in the context of the pandemic, as my colleagues will discuss. Article 11 is an article that reiterates important rights around equality and non-discrimination in the context of emergency situations and situations of risk. As Ciara mentioned, and as a testimony shared from people all over the world reveals, people with disabilities are often, their lives are often undervalued, they're often left behind in response to disasters. And so what this article does is it creates very specific obligation on states to ensure that when responding to situations of risk or disasters, that they do so in a way that fully considers and protects the rights to life and includes and engages people with disabilities. And finally, Article 25 is an article on the right to health of people with disabilities. And again, this creates a whole range of obligations on states to ensure that people with disabilities have access to treatment on an equal basis with other citizens. Also ensuring that measures are put in place so that the right to health, so that people with disabilities can achieve levels of health that are equivalent to levels of health that are that other people in society might have access to. So again, these are far-ranging sets of obligations that again would apply in the context of the pandemic in very specific ways. My next slide is basically to just mention that we have another important document internationally, which is called the Sendai Framework for Disaster Risk Reduction. This is a non-binding international policy that was adopted by states in 2015. And what this document does is it outlines how states should respond to disasters, so how they should prepare for them, how they should, what kind of relief measures they should adopt, and how they should recover from disasters. And what's interesting is that in the Sendai Framework, the Sendai Framework adopts a people-centered and whole of society approach to resilience, which includes people with disabilities. And there's also separate documents that have been developed by the UN around how to integrate and include disability in all phases of disaster risk reduction. And these are measures that include things that are very similar to sort of the things that I've outlined in relation to the convention. So one is engaging people with disabilities in all of the phases of responding to disaster, building capacity of government officials to include people with disabilities in response measures, accessibility of information and infrastructure and support measures, and so ensuring that people with disabilities can access things like any kind of program that's created to ensure the resilience of people in the context of a disaster. Data, so collecting data that's disaggregated in terms of disability and other demographic information. And then finally, one last point I'll mention is the idea of empowering people with disabilities to be actors that are engaged in ensuring resilience and responding to disasters. And on this last point, I'll just mention, and I think the initiative that Ciara has been a part of is part of this, bringing the voices of people with disabilities to this issue. I often say that as someone who has a disability, that in order to thrive, you need to be an expert in resilience. You often will be the best person to know what your needs are. And it's critical that people with disabilities are empowered, consulted, and able to not only contribute to their own resilience, but can also develop innovations that benefit all of society in terms of responding to disasters or pandemics. Finally, it's been notable to see that a number of UN bodies at the very early stages of the pandemic did come out with statements around guidelines that governments should follow to ensure that their responses to the pandemic were inclusive of people with disabilities. So we had not really seen that in previous pandemics or other contexts. And then we've also seen, finally, Keiko, is that my last slide? No, okay, yeah, sorry, thank you. Finally we saw the WHO adopt a similar sort of guidance document. So we have clear obligations on states under international law in relation to disability inclusion that apply to the pandemic. I'll just mention that in general, there's a number of situations in which states might not be obliged to respect their human rights obligations. Those are very limited to situations where the entire nation is at risk. And so very clearly the obligations set out in international law applied during the pandemic. And we had all this policy guidance as well that was set out. And so now we'll have some preliminary results to share with you as to whether in fact states did live up to those responsibilities. So I'll turn it over to my colleagues. Thank you.
Thank you so much, Sébastien. That's really helpful to have the kind of the context of the legal obligations that states have committed themselves to. And I actually especially appreciate the reference to the values and the ethics that should infuse and underpin some of the approaches that governments are taking. So I think that's an actually excellent segue to Dr. Derek Cogburn. I know he's exceptionally skilled at multitasking and is, maybe I shouldn't say that, I don't want to embarrass you, Derek. He's at the same time moderating another session at an international conference. Incredibly impressive. So it's my pleasure to introduce Dr. Derek Cogburn, who is a professor at American University in Washington, DC. He has a joint appointment in the School of International Service, where he serves in the International Communication and International Development Programs, and in the Cogburn School of Business, where he serves in the Department of Information Technology and Analytics. He also serves as the founding director of, founding executive director of the American University Institute of Disability and Public Policy, and is faculty co-director of the Internet Governance Lab. So incredible intersection of different areas, and all come together to advance research in this area of disability policy. So with that, Derek, I'll pass it over to you.
Thank you very much, Professor Lencucha. I appreciate that. I think that we have really set the context very well for the project. And thank you, Sébastien, for really helping to argue why what we're doing is so important, and the questions that we're trying to answer. Next slide, please. So we have an opportunity to collect an enormous amount of text-based resources to be able to answer this research question. And we decided to focus on a standard approach to data science and data mining that's called the CRISP-DM. It's the Cross-Industry Standard Process for Data Mining. And there are 6 stages to this process, and most data mining projects take this approach. So you start with a very clear sense of the purpose of the study. You're recognizing that you're going to have an enormous amount of data that's available to you, and what are the types of resources that you can draw on to be able to answer specific questions. So what's the purpose of the study? And then be clear about what's the availability of the data. Can you access the data? And then how do you prepare that data, restructuring it if you need to so that it's appropriate for helping to answer your question. Then you develop and assess models. So you look at from the range of techniques that are possible in data mining, which ones will help you answer those questions. Then evaluating the findings and deploying the results. That's a standard process for a data mining project. Next slide, please. So we decided to take that approach, apply it to text mining. And when applied to text mining, the CRISP-DM gives you a lot of flexibility, because as you're going through the project, if as you come to each different step, you might decide you need to go back to the beginning and reassess your question, or think about new data that you need to bring into the project. Next slide, please. You also have a range of technologies and other factors that can help facilitate this process, as well as limit the process. So in our case, our goal is to be able to discover knowledge out of this textual data, and to be able to come up with patterns and associations and answers to our questions. And we've got software tools that enable us to be able to take advantage of this large amount of text. We've got domain expertise, tremendous domain expertise on our team. We also have software and hardware limitations on our team as well. Next slide, please. So when you think about text mining, there are two different approaches that we could have taken. There are inductive approaches and deductive approaches. Inductive approaches tend to be exploratory, where we're exploring a data set and wanting to understand what's there. And deductive is when we have a sense of what we're looking for, and we want to be able to go in and confirm the extent to which those concepts or categories are there. Text mining uses both statistical techniques. So there's statistical text mining that draws on something called a bag of words approach, where the order of the words doesn't necessarily matter. You're looking at a numerical representation of the corpus of the text, the collection of the text. And there are natural language processing approaches. In our project, we focused mostly on the deductive side. We wanted to understand the extent to which particular categories that we were interested in were present or absent in the data set. Next slide, please. So when you do know what the categories are, you start with dictionary development, which is where we started. And I wanted to just highlight that even though the project has already uncovered some incredibly interesting findings, there's so much more that we are able to do within this project. So many more techniques and exploratory and confirmatory approaches that we can take. And I know that our entire team is looking forward to some of the next steps. Next slide, please. So when you're developing a dictionary, one of the first things that you want to do is to think about the highest level categories that you're interested in the substantive issues that you want to explore. So in our case, we started with, as our highest categories, the articles of the CRPD that Sébastien laid the groundwork for. There are 50 articles in the CRPD, and those are our highest level categories. And then for each of those categories, we looked at the indicators that come out of the Bridging the Gap project for the UN Office of the High Commissioner for Human Rights, which are ways of measuring the implementation of each of those 50 articles. And that allowed us to develop a dictionary using a commercial tool called the Provalis Pro Suite, and building a dictionary that included categories, it included keywords, key phrases, terms, and also rules to further disambiguate between word usage, so that we could confirm how a word was used in which context, and making sure that it reflected what we were trying to explore. And then finally, we've been able to take a number of steps to validate the model and to explore ways of continuing to strengthen the validation of that particular model. Next slide, please. And that's it. I'll turn it over to Keiko.
Thank you so much, Derek. I'm always impressed at how seamlessly you're able to describe such a complex methodology. So that was excellent. So last but not least, we have Dr. Shikako-Thomas, who's an associate professor at the School of Physical and Occupational Therapy here at McGill. She holds a Canada Research Chair in Childhood Disability, specific to participation in knowledge translation. Her research program focuses on identifying mechanisms to create healthy, inclusive communities for children with disabilities through interventions aligning technological and social transformation. She leads several knowledge translation strategies, bridging research on childhood disabilities, community stakeholders, and public policy. And I have to say, is also able to work seamlessly across levels of government, right from the municipal level to the United Nations. And it's very impressive to see all of the work that Keiko has been doing. So Keiko, with that, I'll pass it over to you. And yeah.
Thank you. Thank you, Raphael. Thank you, everyone. This is a great introduction, a great understanding of some of the complexities that we've been working through in this project, which the research question was put before, but a lot of the co-investigators involved in this project are here in the room. Dr. Lencucha, Dr. Cogburn, Dr. Jodoin, and others that are in the audience. So this is a project we've been looking at, as Derek has mentioned, into how different countries have responded to the pandemic and in relation to the persons with disabilities, and particularly how the policies that are being proposed or the guidance that is being put forth by countries has responded to the needs of persons with disabilities in different countries. These are the countries we selected for our analysis. We had selection primarily countries that have English or French as their primary language, so we could access the documents. And we selected countries across the 4 different income categories and across all the 5 regions. To try to understand a little bit the differences and compare how different countries have done different responses in relation to the pandemic. So we have, these are the countries, as you see, that we've selected, and this is data from the Johns Hopkins COVID data tracking, just to show the number of COVID cases per million during the time that we've been analyzing documents. So we started our data collection back in July 2020, and we're still collecting data. So this will present to you some partial results, but we're still analyzing this data using the methodology that Derek so nicely explained just now. And we also composed what we call a dashboard of these countries, just to understand the context of the pandemic, how it's unfolding in those countries. For example, this presents the stringency index. Again, this is not our data from Johns Hopkins, comparing how restrictive the policies were in general in relation to preventive measures and public health measures in the different countries that we are analyzing the policies. So from these countries, we collected policies that were specifically to COVID and disability. So that was the main criteria. So we got actually all the COVID policy responses. And within that, we analyzed using WordStat the different categorization models as well, inductive and deductively, as Derek explained, to understand how the policies in relation to COVID were aligning with the different disability issues. This is to give you a sense of the volume of data we captured. So most Canada and India had a lot of documents. So that's just number of documents collected from January to March, January 2020 until March 21. And Canada and India had a high volume of documents that were produced, with other countries understandably having less. And we had way more documents in English than in French, but as you see, there is a variation just on the amount of documents related, again, to COVID that we entered in our analysis. Different country categories, and this is just, again, on volume of documents obtained. So from high, upper, middle, lower, middle, and low income countries. And this is, sorry, it's missing, I realize here, it's across the different months, again, from January last year until March 21, the number of documents obtained according to the different categories, income categories for these countries. So we started with this inductive analysis and trying just to see what are the phrases that were most frequent in the documents we obtained. So and that confirms a lot that the documents have the content we're looking for. So a lot of the documents talking about public health measures, SARS-CoV, healthcare, physical distancing, and then more vaccine towards more recently, or as of fall last year, the documents started to show more of a vaccine into the text. We also did something that is called topic extraction, and that helps us understand how different words are coming or sentences are coming together, forming specific topics within this data. And interestingly, children and youth was a group that was a topic that came up in this inductive analysis. Also high risk, but in relation, not necessarily in relation to high risk populations, but just high risk of transmission, risk assessment, etc., and support services. So that, again, in general, not specifically in relation to disabilities, but just the topics that came up in a first analysis. Then we built one categorization model that was more specific about COVID disability guidance. So taking from the documents that Sébastien mentioned in his presentation. So some of the WHO, UNICEF, the Sendai framework, we built a categorization model that would look into those documents and what is the guidance for them. And we found that most of the documents that were collected from the countries have some aspects that talk about the general guidance in terms of including persons with disabilities or considering the needs of persons with disabilities during the pandemic responses. Less documents, but some also considerable, we talked about assistance and supports. And again, in a general way, following this categorization model that we built for following the guidance from these different documents that are specific, that were specifically created for emergency response or the COVID pandemic. And less so about protective health measures, socioeconomic equality, and community participation. And non-discrimination, there was not many hits in this first analysis. We then looked into all these documents, put into this the categorization model that Derek explained using the CRPD indicators. So the bridge the gap indicators being the second layer. So we had one layer that included all the 50 articles of the CRPD, and then a second and third layers that included all the indicators that are proposed by the Office of the High Commissioner in Human Rights, Bridge the Gap project. And those indicators, just to, for those who are not familiar with, they're about structure, process, and outcomes that are necessary to make sure that the CRPD is being implemented. So that was a way we used to understand in more details what the content of the documents and how aligned it was with the different CRPD indicators. So from that, we can see that Article 11 was one of the most the highly mentioned in these documents. And as Sébastien mentioned, Article 11 is about situations of risk and humanitarian emergencies. So that is good. It shows that there is an alignment with the language used in this article and the policy documents that were produced. Similar interest in second place for Article 19, which is about living independently and being included in the community. And a lot of this article language is about giving equal opportunities to have support services, including personal assistance, and also community services, including health services. And that's the content that we found more in relation to Article 19 in this document. There was less about accessibility and articles related to right to life, which is interesting and may come up. We'll do some further analysis to see what's missing or why these articles were less addressed in a pandemic response, which we should consider aspects related to that as well. We then conducted a more, and that is just preliminary results on some of more in-depth analysis of the content of this policy documents, and trying to compare what are the disability needs that we saw, and that aligns very well with what Ciara said, mentioned in the project when they collected testimonials from different countries. So trying to compare those with the policy responses or the policy documents that we identified. So some of the upcoming themes that we see are in relation to diversity, for example. So highlighting that people with disabilities, persons with disabilities, have similar challenges as the general populations, but they do require individual accommodations or particular considerations for their needs. There's a lot of mention in terms of accessibility, more concrete accessibility measures in relation to, for example, as we see here, access to services that are physically accessible, but also accessible services in relation to staff, personnel, information receiving as people, as we advance through the pandemic. So important considerations in relation to the diversity of people with disabilities is not one group, but a group with different characteristics, which is also something we see in the topic that we are seeing about intersectionality. So that was also mentioned by Ciara in the different groups. So the fact that persons with disabilities may also be children and women, elderly, they have, there's a high number of people with disabilities who are institutionalized and therefore require special consideration. Also, people who have many comorbidities that put them at higher risk in the pandemic response. So this is an example of Malawi's document saying how the plans needed to target populations and families affected by the outbreaks, but especially those marginalized and vulnerable, which includes a lot of populations, and often persons with disabilities belong to all of those marginalized groups. When you talk about risk and discrimination, there were different aspects that were mentioned in the different policy documents, such as triage protocols, access to personal protective measures, accessibility to community and healthcare. So in all phases of pandemic development, so both testing, treatment, and vaccine more recently, all of those were addressed partially in different documents. So one area, as this quote from India's COVID guidance, one area in which requires more focus is the scrutinization for disaster protocols. So this idea that disaster protocols must respond to this, to the disability needs from the beginning, according to the guidance that was provided by the different international agencies. When it takes some extracts from specific articles, when you're using our categorization model, we can see, for example, for Article 11, in relation to access to community living and services and supports, we see examples of guidance, for example, from Canadian documents showing a worry or specific concern about accessibility to hand sanitizer, so more protective measures that were put in place in the different stages of the pandemic development. Also to think of more the concrete ramps, accessible parkings to the testing facilities, but also some consideration, which was less prevalent in these documents, but some consideration for characteristics of people who might be afraid, anxious, have cognitive or intellectual disabilities, which are often not considered in many of those responses. One example, to include a French example, but we had some volume of documents in French. So from France, this document specifying that there are laws in place since 2005 guaranteeing equal access of rights and opportunities for people with disabilities, and that this should be considered and should not be different. They should have access to information, which is an important point as well that was flagged in different projects in relation to persons with disabilities, that access to information is not always equal across different groups and different needs. That aligns with another project that we are also conducting, a WHO report on disabilities in Canada. This is the report from Canada. Full credit to Dr. Gonzalez and team that we are interviewing or surveying families and identifying needs, and this need to access to information actually becomes clear that families do feel the need, and they do feel that they did not have the necessary information to take precautions, to understand what was happening next to their children with a disability in relation to school, to supports, to financial supports, and other aspects. So information is important, not only community physical access, but access to information into what's going on. So we have many interesting questions and gaps that we're still to explore. Issues of implementation, so how countries are really prepared to respond to emergencies like the COVID pandemic. the governance structure makes a difference. So some countries have a focal disability point that also reports, for example, to the UN in relation to the CRPD. And in countries where this is a reality, it may be easier to make quick responses that are inclusive, that do take into consideration the CRPD articles, and also countries that have different national, subnational organizations that may have an impact on the ability to provide equal and distributed responses that follow the CRPD guidance. Also, in terms of the comprehensiveness of the policies, we saw a lot, we're still analyzing, but we see a lot of the policies focusing on, of course, the priority emergency responses, so access to testing or to protective measures, but really less consideration for the unfolding of the pandemic, but the social consequences as well. So the disparities, the gaps are enlarged during the pandemic, and people who were marginalized before have a trend to be even further marginalized after the pandemic. And the lack of inclusion of the CRPD articles as part of the current ongoing national policies is made more evident during the pandemic. So beyond accessibility and beyond the pandemic, how this idea that Ciara also mentioned, how do we build back better, right? And not go back to what it was before, but create systems that are responsive from the beginning, so that when emergency hits, we are ready, or countries are ready to respond, and also the idea of inclusion, which Sébastien also mentioned. So the importance of having a disability advisory council put together, or having a group of persons with disabilities actively contributing to the development and advocating and suggesting changes or the necessary measures, and establishing priorities with governments. And responses to consider a diversity of the group of persons with disabilities, from age groups to other types of disabilities that are not only physical, and that should be considered in these responses, as well as the importance of having adequate resources allocated, which we're still to explore in this data, but we see that there's a gap in financial supports, for example, or the necessary resources to provide a comprehensive response. Thank you very much. So that's that. I hope we still have some time for discussion.
We definitely do. Thank you so much, Keiko, and thank you, everyone. So we haven't, it's scheduled to go until 1:30, but I've been told that it's okay if we end up going a bit later, if the discussion warrants it. So we already have a question in the chat here that I'll read out. And just or as a reminder, if you have a question and you'd like to ask it directly to the speakers, you can just use the raise hand icon, and hopefully I'll be able to see that. And if you prefer to write your question in the chat, please feel free to do so. So the first question, which is really an excellent one and very practical. So the question is, for the students studying public policy, is there anything any of the speakers can suggest that students can do in improving conditions for those with disabilities in Canada? So a broad question, you can take it on at whatever angle you want. Thank you, Ellen, for that question.
Raphael, can you repeat the question? Sorry, and was it specifically to someone? Sorry.
It was to anyone who feels inspired to respond, and it's for students studying public policy.
Okay.
Is there anything that can be suggested that students can do right now in improving the conditions of those living with disabilities here in Canada specifically?
I can take a, I can try to, this is a great question. I think for what we've seen in this data, I think for students in public health, it would be great to be familiar with, or to get more acquainted with the CRPD or other normative frameworks like that. I think this is something that is not necessarily part, and I don't know, I'm saying without knowing what the curriculum, how much you learn of this in the curriculum, but I think getting familiar with it and understanding what are the mechanisms for implementation, how it normally can be used on a daily basis in public health measures, I think this would help and will make for public health practitioners that are readier to implement that when you're in practice. So I think this is the immediate take for students, but I don't know if others.
If I could add to that, I know I would encourage that as well, to become familiar with the CRPD and how it's applied. And I think Sébastien also laid the groundwork for some of the other kind of the bricolage of international agreements and organizations, like the Sendai framework, the Habitat 3 and the New Urban Agenda, how all of these inclusive development frameworks and strategies come together to support each other and to reinforce each other, including the Sustainable Development Goals, which have a very strong component of inclusivity and disability inclusion. And thinking about the degree to which you are aligned with those frameworks will help you with almost any institution or organization that you are attempting to work with, because so many of those organizations are aligning their strategies, their frameworks, and their programs and projects along those lines, just like so many are aligning their projects towards the CRPD as well.
Thank you both very much.
Thank you. And there was a hand, Sabrina Gill, did you have a question you'd like to ask? Oh, sorry, just muted.
Hello, my name is Sabrina and I use she, her pronouns. Thank you all for speaking with us today. My question was in regards to the consultation process, I guess at the beginning of emergencies, because I know it's important to get input quickly, but I understand that getting input quickly can also sometimes compromise the quality or the amount of input that is received. So I guess my question is, in an emergency scenario, what have been the most effective strategies for getting input as fast as possible in order to inform responses without compromising quality? That's my question. Thank you.
Maybe I can come in on that.
Yes, Sébastien, please. And then
Yeah.
you can...
So ideally, first of all, you have consultative mechanisms in place before the emergency begins. Ideally, people with disabilities have been included in the development of the institutions and mechanisms that you'll use in response to future emergencies. And unfortunately, we haven't seen that in Canada. So they had to put something together for the pandemic. But we have students recently, I looked at all the disaster readiness emergency plan policies across the country at provincial and federal level, and there's nothing or very little on disability. So that's a problem. So you need those existing mechanisms to be in place. And then there is some research on including people with disabilities or disabled people's organizations in response to emergency responses. And there's some interesting research on this in Indonesia. And what you see there is that these were sort of, again, it was kind of empowering and connecting to existing groups and networks and resources, as opposed to inventing something new. So I would say a sort of disability inclusive response has to begin way before the emergency ever manifests itself. And then if you have, you will normally find that there are existing groups and networks that are already present, that have the expertise, the knowledge, can also communicate information. And so it's a matter of connecting with those, as opposed to, and also empowering those or funding those in the long term, as opposed to sort of in a sort of immediate ad hoc basis.
Thanks, Sébastien. And Ciara, I think you had some insights.
I did, yeah. So it's a great question. I just wanted to respond quickly, and agreeing with Sébastien there that it needs to be a bit much more long-term consultation process. But I suppose in relation to just the phrase that all of us probably know by now, nothing about us without us. And I know it's used by the disability rights movement a lot, but in terms of consultation, it's also important to look at the types of consultation that's done with people with disabilities, because sometimes it's quite tokenistic. Whereas really what I know a lot of disability rights activists are really looking for is a seat at the table, at the policy making table. So that really needs to be looked at in terms of, if a government are saying they're consulting, then what type of consultancy is it? And does it also intersect with different disabilities, or is it just one group being represented? So I think we have to be quite critical of the types of consultation as well that governments are conducting.
Thank you so much.
Thank you so much, Sabrina. Are there any other questions? Yes, Ari, I see your hand just popped up, and then we'll move over to Michaela.
Hey, great series of presentations. So my thanks to all of the speakers. I'm sure I joined the rest of the audience in saying that I learned a lot from that session. So my question is really about enforcement. So, the text mining was super interesting in terms of thinking about the kind of enactment and implementation of the frameworks and conventions in documents. But I'm wondering whether there's specifically any empirical evidence of enforcement that complements the kind of work, that research that Ciara was doing and the testimonials. So for example, is there evidence that there is equal access to information, that we see that public health measures are being distributed equitably in terms of things like screening and testing? I'm just kind of curious about that. I was wondering if anyone could comment.
Ciara, you want to go first?
You can go ahead, Sébastien, if you want to answer.
Well, I was just going to say, litigation. So we've seen litigation around triage protocols in a few places. And I think that's going, but that's, so just to situate people, in international human rights law, the sort of compliance mechanisms tend to be rather weak internationally. And so the best evidence that we have around how human rights obligations gets translated into practice is usually because they are mobilized by civil society groups working domestically through advocacy, but also litigation in countries that have that sort of culture and those opportunities. And so we have seen litigation pop up in relation to triage protocols specifically in different parts of the world. And maybe we will see more, we'll see things in the aftermath of this. Certainly, there are some states, there are some places in the world that my work on climate change, I've seen litigation come up around inaccessibility after responses to hurricanes that were not disability inclusive. So I imagine we'll also see a wave of litigation after the pandemic in different parts of the world.
Yeah, I don't have any information on specific legal cases. I was aware of a communication that was made with the Romanian government, for instance, by the special rapporteur regarding institutions where people with disabilities were denied equal access to healthcare. So that was, I suppose, an opportunity for the Romanian government to respond to those allegations, and they did. And I think the information is public. I don't have any access to it at the minute, but that's just one example that I've seen where, an international human rights body has tried to hold a government accountable for unequal treatment in institutions.
Thank you for those responses and for the question. So Michaela, I'll pass it over to you if you wanted to ask your question still.
Hi, thank you. My name is Michaela, and I do work with a disability organization in research. And it's really tough because I do have lived experience, and there's this expectation that we have the information from the, from the disability, from the community side. But, when we look at what's happening in terms of the funding and economic models, right? And then also too, like, you have the government wanting consultations, you have every kind of municipality wanting consultations, and quite often it's free. And then we have the advisory bodies that give advice or may try to raise an issue, but that in the context of a pandemic, it may not be heard, but then too, like a decision may not be also captured at different levels in terms of discussions. And so we've been finding some of that happening as well, because we had a student who's doing an environmental scan, and in cases of the municipal level, like there was some cases that just the municipality got documents just were not up to date. And so I kind of wondering is like, how can we address that? Because the way people cope on day-to-day circumstances, you know, circumvents the policy because there's just the big gap. So I think that was some of my commentary. So thank you. It was a wonderful presentation.
Thank you for that thought. And I know Sébastien has to leave, so thank you, Sébastien, for your presentation and your participation in this process. If I can ask a question, actually, I don't see any hands up at the moment, and it was similar to Ari's question. I was wondering, because you have this really interesting information about from the perspectives of persons with disabilities who know that there is this experience or this perspective that the government isn't responding to their needs or isn't providing the support or care that's required. And there was over 30% of the people that were saying that. And I think Keiko, your study confirmed that those numbers were similar to Ciara's. And I'm just wondering, what is the dynamic between the experience of persons with disabilities and what's happening at the policy realm? So like I can imagine it's possible that there are policies on paper that are just not making their way to the people who they're meant to support and address. And I'm just curious to know your thoughts on that, whether we know what that disconnect is, and if we don't know, how do we go about kind of exploring what dynamic kind of informs that disconnect?
I just think it's interesting that, you know, the DRM survey was conducted at the relatively early stages of the pandemic. You know, it was open a year ago, so we're so much further on now that, you know, we have, I suppose, more documents, policy documents have been developed, but it was just very interesting that we were sort of alerted to things that, you know, we didn't see in the media or any kind of discussion around at the time, and that we thought were quite shocking. But as time goes on, we realize that, you know, it was the people who are actually pointing us in the right direction, that, you know, several very serious human rights abuses were occurring. So it just highlights the importance of that sort of ground level feedback from the people who are experiencing things in their everyday lives, that we need to have that insight as well. You know, both the policy analysis and that sort of real lived experience on the ground. And you know, it did kind of draw our attention to a lot of big issues, like the do not resuscitate orders that I mentioned in the presentation, for instance. That was not in the media at the time, where we know now that was an issue, at least in the UK. So it's interesting to see that gap.
I could make just one contribution, Raphael. I think for me, one of the things that I'm excited about, and I think is a challenge, is there are increasing networks of civil society activists, of disabled persons, organizations for persons with disabilities, that are able to work at grassroots levels, local levels, national levels, regional levels, and international levels, global levels. And there are very active networks of disability advocates around the world that are trying to help facilitate that conveyor belt, if you will, of information and pressure that can be brought to bear on national states, and also raising those issues at global levels. And I think that it gives me some sense of optimism that there's a vehicle for raising those issues, and also it gives me you know, some level of disenchantment, because it is really challenging and difficult to actively participate in all those spaces. And so To me, it suggests that there's a lot more work for us to continue to do to try to help facilitate that process and be allies where we can.
And if I may just on following up to that, to what Derek was saying, I think the issue and the challenge is also connecting with the groups that are not connected, right? So the people who respond to the surveys, who participate in the advisory councils at national, subnational level, it's always the people, not always, but mostly the same people and the same groups who are the ones who have the tools, who know the frameworks, who know how to advocate. But there's a lot of groups within disability and others, children, families, indigenous, other populations that are not involved, and they have less tools and resources, get less access to information, and therefore less represented in the final product. So I think that's an important consideration to keep in mind.
Yeah, thank you all. I think that last point, Keiko, too, applies across, like if we're looking at global governance in general. I think that that's an important piece of the puzzle in terms of ensuring that voices are heard that are often marginalized, and usually those are the ones that the voices that are the ones that need to be heard to fill in some of the gaps that we're identifying. Thank you so much. I think we've kind of reached our time. So unless there's any last burning questions, we can close it off, I think. Nick, Ari, I think.
I just want to say thank you so much for having me here. Even though I was doing a little bit of multitasking, I was enjoying it so much and enjoying my colleagues and enjoying everybody. So thank you very much for organizing this event.
Yes, thank you so much, to Anik and Ari. It's great to have this opportunity to discuss these issues at the IHSP. So thank you all, and thanks for all who attended. It's wonderful.
Thanks, everyone.
Have a great day.
Bye.
Bye.